Um, so today I think it's the last class, right? Birth defects. I'm gonna give you guys information of birth defects. First, introduce myself. My name is Shun Zhu. I'm an instructor in Department of Cellular Genetic Medicine, same as the other teachers. First, I would like to show you a video, actually. Let's see if we can play it. Maybe I need to open from here. Yeah, pay attention to this kid and his dog, actually. It appears normal right now, but you can see the child's face actually looks a little bit weird, and later you can see he tries to avoid to play with the dog. Yeah, in other words, this kid looks a little bit not quite social. Yeah, see, he tries to avoid eye contact and avoid contact with the dog. So, guess what kind of genetic disease this kid have? Yes, as you imagined, autism. And we will give you more details of this genetic disorder later in this class. Is my voice too low or too high, or you think it's perfect? Okay, great. Okay, so this autism is a form of genetic disorder, or and which is a birth defect. And so first, I would like to give you an outline of today's talk. First introduction, I'm going to give you some basic information of birth defects, like what it is and how is it formed, how common are the birth defects, stuff like that. And after the introduction, we will go into details about each type of birth defect. I mean, the most common type of birth defect. For example, genetic defects, neural tube defects, mouth facial defects, limb defects, congenital heart defects, and finally, I will give you a summary of today's talk. Yeah, so first, introduction. So what are birth defects? And yeah, so basically these birth defects are sorry. I need to get my pointer. One sec. Abnormalities of the structure or function of the body parts that are present at birth. Yeah, like the first one is it's abnormalities of structure and function, and the second point is it's present at birth. So basically, it can be divided into two types of birth defects. The first one is related to the structure change, so it's called structure birth defects. The second one is the functional change, so it's called functional birth defects. And one needs to be aware of that birth defects are actually not impairment of those body function and structure due to those adverse influences at which condition the infant was born. For example, like birth trauma and birth injuries, those are the type of words that are used to describe this type of situation. So birth defects are indeed like more have more inside reasons, like inner reasons, like genetic defects or genetic mutations, stuff like that. So let's continue. Birth defects. So it's basically structural birth defects. Those are related to how a body part or structure looks. For example, the following types of defects are in this category, like cleft lip, cleft palate, or those heart defects related to misshaped valves, or some abnormal limbs, like club foot. We will talk about this in more details later. And neural tube defect, like spina bifida. Those will cause structure changes, abnormalities of the body structure. And the second type is functional birth defects. It's related to how a body part or structure works. For example, central nervous system problems like the Down syndrome. It's related to the chromosome aberrations. And also sensory problems like blindness or metabolic disorders like the PKU disease, degenerative disorder like muscular dystrophy. However, although I categorize the birth defects into two categories here, but actually they're actually interrelated. What I mean is like some of the structure birth defects have some functional reasons. And so this is the definition of birth defect. Here just show you a collection of like most of the birth defects into a word cloud. Hopefully you guys can see it more clearly. Like the bigger size of the font means the word appears more frequently in the text I give it as input. You can see like congenital, trisomy, cleft. These words are actually the three most frequent words, which actually highlighted the characteristic of birth defects, which means it's congenital, like it's present at birth. So how common are these birth defects? We may ask this question. In fact, by doing this kind of research and epidemiology studies, people found that in the US or in the world, around 3% of babies born were born with a birth defect. This is actually quite a big number if you consider the total number of babies born in the world. For example, to the left of here, this is a graph showing the birth defect rate across each year for the U.S., I believe. And to the right here, it's actually international survey which studies the birth defects happening across the world. For example, at that year, there were 4.5 million birth defects each that year, and which is around 3% of the world population that were born at that time. So, in one word, I think it's quite common, 3%, if you consider that number. So here are the top six common birth defects listed by CDC or Center for Disease Control and Prevention in the U.S. Those are genetic defects. It's around 700 babies born per year for this type of defects. And the second one is mouth and facial defects. For example, cleft lip. It's around the same number, but it's a little bit lower. Also, the next one is heart defects, musculoskeletal defects, and stomach intestinal defects. The last one, eye defects. So there are, we may wonder what are the causes of these birth defects. And in the following, I'm just going to give you a brief introduction of those causes. So at first, in ancient times, people may have those type of misconceptions. People may think birth defects are actually a punishment by God, like because they believe we all have sins, so the God needs to punish us, so we have birth defects. And later, in some parts of the world, it was also believed that unsatisfied wish of pregnant women will also cause birth defect, like this birthmark. For example, you probably noticed what this birthmark looks like. Yes, it looks like a strawberry. So which means they interpret it like this, like the pregnant woman wants to eat strawberry very much. That's why it gives birth to a baby with a birthmark of strawberry. So nowadays we know these are all misconceptions, but what are the real causes of these birth defects? So although we don't know the cause of every birth defect, in fact, most of the birth defects have unknown etiology, but we generally know these type of reasons for birth defects. The first reason is genetic reasons, like faulty genes. For example, when genes get mutated or the chromosome have some aberrations, etc., like we will have birth defects manifested. And also, the second reason, very important one, is the environment. If we have this adverse environment, like, for example, exposure to those chemicals, chemical, physical, and biological factors, we will talk about in the next few slides, we will also have birth defects. And the third reason is also important, like interactions between genes and environment. So basically, it means the babies were born with like a not perfect gene, and when it is encountered certain harsh environment, the birth defect will show up. And as I said, most of the birth defects have unknown reasons, which requires further research. Some examples here. So one of the very famous or notorious cases of this birth defect is thalidomide, which is actually a drug brought to the market by a West Germany company in 1960s, early 1960s. However, when they brought the drug to the market, they did not do adequate testing. I believe they only do testing of the, actually at that time the drug that was taken by the pregnant woman was not seriously or strictly controlled. And also they did not test the effect of this on pregnant women. They only test the effect of the drug on pregnant rodent, I believe. That's why, because of this inadequate testing, when it was brought to the market, they found, although it can be used to treat pregnancy reactions like those morning sickness, however, it will cause severe birth defects, and the most serious one of them is limb defects. So, for example, if you look at this child, it has a very reduced or very short limb, arm, and they estimate around 2,000 babies actually were not born because of this thalidomide. And also there are around probably 50,000 babies born with this limb defects. And this is, to the right of this, it's actually a very interesting story here. At that time, there's a lady called Frances O. Kingsley. She was actually a reviewer. She was actually a reviewer of this thalidomide drug for the FDA in U.S. When this drug tries to be commercialized in U.S. But eventually, she decided that they don't have enough evidence to prove the safety of this drug. So she actually denied the drug's entrance to the U.S. market. That's because that's why in U.S. There's actually no limb defect cases happening. Okay, the other example is this rubella virus, which is actually a virus. If this infected this pregnant woman, it can cause very severe birth defects, such as this sensory neural deafness or this eye abnormalities like cataract in this picture of the baby. And also, it can also cause congenital heart disease. For example, this pulmonary artery stenosis. To the left, this is showing the virus. Also, for radiations, if all of these are actually environmental factors. If those pregnant women were exposed to radiations, it will cause very severe and diverse birth defects, as you can see in the picture here. People may ask, yes, radiations are actually usually from two sources. The first one is like nuclear war, nuclear bomb, and actually in the peacetime, we also have those nuclear power plant leak. For example, in the 1986 Chernobyl power plant leak, those babies all have all types of birth defects. For example, this cyclopia birth defect in which the kid only has one eye, or those double-headed human or pig. These are all sorts of defects that can be caused by radiations. Okay, so these are some examples. And here are some other examples concerning other factors, chemical or physical, which can cause birth defects, such as this antibiotics, tetracycline, taken by the pregnant woman may affect bone growth and teeth of the baby. Or the other medicines, alcohol, smoking, bacteria like Salmonella can cause the problems for continuing pregnancy. Also, some other parasites, such as this Toxoplasma, can also cross the placenta and lead to serious birth defects. Actually, these birth defects where the sensitivities of the fetus are different at various stage of developmental stages. For example, if you look at the development of a fetus here, from a small baby to a embryo, from embryo to a small baby, you can see it. Different parts of the body have different sensitivities to birth defects. For example, this central nervous system, it has a very long blue bar here. It means this blue color means highly sensitive. It means in this very long period, this central nervous system are sensitive to getting birth defects. And the green one actually means less sensitive. So, if you compare all of these different parts of the body, you can see the central nervous system is actually sensitive in most period of the fetus development. Okay, so these are some brief introduction of birth defects, and next I will give you a more detailed explanation of all of these birth defects. For example, actually, first I'm going to introduce these genetic defects. You probably have already learned some of those from Professor Sullivan, but I'm just going to just briefly go over these. So the first one, so there are multiple types of genetic defect here, probably thousands or hundreds of thousands. I'm not going to introduce each one because of the time limitation, so only a couple of typical representative ones. For example, this Down syndrome, it's actually one of the most known and popular birth defect people will talk about. Its occurrence is 1 in every 1,000 babies. So it's actually discovered by Sir John Langdon Down in the 19th century. He's the first physician to describe this syndrome. That's why it's called Down syndrome. Actually, the name was also was only recently described by the WHO, and originally it was named as Mongolian idiocy because the face of this type of Down syndrome patient resembled the face of Mongolia, like flat, very broad face. Yeah, so if you look at the picture here, it's actually a very old painting from Renaissance, and people suspect some person in this graph have this Down syndrome, although they don't even know what they have at that time. So this is also known as trisomy 21. It's basically this have known causes. It's a genetic disorder caused by the presence of chromosome 21, like all of chromosome 21, or sometimes part of actually genetic. Yeah, so this is actually, this is not fully correct. It's trisomy. It means that chromosome 21, originally we have 2 chromosome 21, but it will, in this Down syndrome, it will have an extra one, which means it has 3 chromosome 21. So it's the most common chromosome abnormality, and as I said, it's 1 in every 1,000 babies. You can see the extra chromosome of this chromosome 21 here. For the other chromosome, it only has 2 chromosomes, but this one has 3. So it's an extra chromosome. These are some common symptoms. You probably have already learned that. For example, like those growth failure, mental retardation, broad flat face, or this palm crease, actually. This is very distinctive. And it will also have some other type of disease, like also congenital heart disease, because this itself is also a birth defect, which I will introduce later. So how do we know if the baby has this Down syndrome even before it was born? And so, in other words, how do we test and diagnose this disease? There are basically 2 tests here. The first one is called screening test. It's basically used to indicate the likelihood of a mother carrying a baby with Down syndrome, which means it only tells the likelihood. It's not definitive. And for the other one, it's called diagnostic test. It can actually identify whether the baby has Down syndrome, which means it can identify almost 100%, because it actually looks into the chromosome shape, the chromosome numbers under the microscope, and see if it actually has 3 chromosomes for 21, number 21. And here's this is a blood test. It's one of the screening tests. And here it's the amniocentesis, I believe, which I will talk about later. It's one of the diagnostic tests, which can tell definite numbers of chromosomes. So first, I just want to introduce like the pregnancy timeline, because some of these tests are meant to be done at different time period during the pregnancy. So basically the baby was born 38 weeks after fertilization or conception. And these 38 weeks are divided into briefly 3 periods. The first one is, they're actually called trimesters, and so there are 3 trimesters here. Is the first trimester, the second trimester, and the third trimester. So the first trimester actually carries the highest risk of miscarriage. So which means if some of the tests are actually done in this period, it may carry a slight risk of miscarriage. And the second trimester, in the second trimester, the development of the fetus can be monitored more easily without sacrificing the miscarriage risk. So the third trimester is actually marked by some further growth of the fetus and fat stores until before it was born. Actually, if you can tell, at this 23 week, there's 50% chance on the survival chance for the birth. Okay. So first, the screening tests. Some methods for the screening tests. The first one is called the first trimester combined test. It's basically a combination of blood test and ultrasound. So blood test is measures the this type of protein, PAPP or PAP-A in the blood, and also measures this hormone known as human chorionic gonadotrophin, or HCG, and abnormal. So normally, so they have a normal or standard level of these type of proteins, and if it deviates too much from the level, which means abnormal levels of these proteins, it will indicate a problem with the baby. In this case, it may indicate Down syndrome. And also the second one is this is more like a chemical test. And this ultrasound one is actually used to more like a more straightforward way to look at the baby, and it will measure a specific area on the back of the baby's neck. This is known as neutral translucency screening test. If they found more fluid at the back of the neck, it means there might be some problems occurred. The second one is called integrated screening test. Actually, it's because it integrates the results from the first trimester test, in which we use a blood test to measure PAP-A and ultrasound to measure the neutral translucency. Also, we have a second trimester test, which is actually called a cord screening. It's used to measure this blood level of 4 substances which is related to pregnancy, which are alpha-fetoprotein, S-triol, HCG, and inhibin A. And the results from both tests are actually combined and to assess the risk of Down syndrome. This one actually has about the same accuracy of detection compared to the first trimester combined test, which we shown earlier. And it also has a lower this false positive rate. So this one is actually preferred to the first one if you just want to do a screening test. But what if you want to know for sure that it has 2 or 3 chromosome 21s? sorry. So there's another one. There's another screening test, which is the cell-free fetal DNA test. It's actually also a screening test because it measures these DNA fragments in maternal bloodstream, but these fragments are actually from the baby, from the fetus. This can be accessed by venipuncture, and which is also a non-invasive diagnosis. And as you can see in this picture here, in the maternal bloodstream, there are two types of DNAs. The maternal DNA, or the DNA of the mom, is actually colored in green, and those white ones are actually from the fetus. So, but those are not complete DNA. So they're not chromosomes. That's why they cannot look into chromosome 21 and say if it has an actual copy. Those are fragments, but they can still be an indication of for this type of test. Okay, so next for the diagnostic test. So this is for so we can know for sure it has Down syndrome or not. There are basically three types of tests here. The first one is called amniocentesis, in which case they use a needle and insert it into the amniotic fluid under the guidance of this ultrasound transducer. So they can take a sample of this amniotic fluid, and in this sample it has fetus cells. They can look into the cells and tell if it has 2 or 3, if it has trisomy for chromosome 21. This test actually has a slight risk of miscarriage, and so if it's done before 15th week. The second method is called chorionic villus sampling. This chorionic villus actually is grown from the fetus, so it's actually the tissue from the baby. That's why we can sample it and look into its chromosome composition. And to the right, you can see two types of CVS. This is also called CVS. One is kind of a transabdominal type of CVS. The other one is transcervical. They're down from different origin, but they actually they take the same tissue. There's chorionic villus, and look into the chromosomes. This also have a slight risk of miscarriage. This also have a risk of miscarriage, but it has a little bit higher risk of miscarriage than the second trimester amniocentesis. So the third method is called chordocentesis. This is also similar to the amniocentesis. The only difference is the tissue is taken from the vein in the umbilical cord. The procedure is similar, using the needle going to the umbilical cord under the guidance of the ultrasound, but the tissue taking is a little bit different. So this is usually performed between 18th and 22nd weeks of pregnancy. It also carries a slightly greater risk of miscarriage than the previous two methods. But again, these methods can, because it's looking directly into the cell of the baby, it can tell 100% or 99.99% if it has trisomy. The second one is Marfan syndrome. You probably already know this. So the occurrence of this is 1 in every 5,000 babies. It's a little bit less frequent than Down syndrome. Basically, it's a genetic disorder that affects the connective tissue, which holds other tissues together. It can affect multiple body systems, including heart, blood vessel, bones, eyes, lungs, skin, but usually not intelligence. And it can become mild or severe. It can also happen at birth or actually later in the childhood or adult life. So typical symptoms are actually listed in this graph. Typically, people with Marfan syndrome will have eye problem. It will have this. The most distinct feature is actually this long arms, legs, and fingers, because of this like almost uncontrolled growth. So why does it happen? And the people are looking to the causes of this Marfan syndrome, and although it's still under study, they found a gene called FBN1 gene. It's used to encode this fibrillin 1 on chromosome 15. And as you know, this fibrin actually forms these thread-like filaments, which in turn forms microfibrils. And this microfibrils is used to provide the strength and flexibility of the connective tissue. And the microfibrils also store these growth factors. Because of the function of this microfibril, any mutations in this FBN1 gene will cause a dysfunction of this microfibril, and so microfibril stability will be lost, and also its ability to store this growth factor will be lost. So the growth factor is released and cause this extensive growth of these fingers and toes. That's why their fingers and arms looks very long than normal people. Okay, so this is another syndrome. It's actually a French word. I believe it's called Kidusha, something like that. But it's usually it means actually, the occurrence is 1 in 50,000. This is very rare. It basically means this name means call of the cat, because when the baby was born, when they cried, very much like a cat. It's also known as this chromosome 5p depletion, because the cause of this genetic disorder is because there's a missing part, or there's a deletion of this chromosome, a copy of the chromosome. As you can see, to the left here, this is a normal chromosome 5. And this, to the right here, you see a portion of it is actually deleted. This is a normal phase of a Kidusha syndrome baby. The last one of genetic disorder I want to introduce is autism, as we've already seen in the video, which is 1 in 1,000 babies occurrence. So basically, this autism is a neurodevelopmental disorder. This characterized by this impaired social interaction, verbal and nonverbal communication, and also this repetitive behavior. As you can see in the video before, the kid and the dog, it tries to avoid contact with the dog. It's a type of impaired social interaction, or this nonverbal communication. The causes of autism are actually still under study. It's a complex disorder whose this core aspects is still under study, and they often have many causes that occur together. They found it has a very strong genetic basis, but they are still trying to. It's still unclear whether this autism is explained by Which reason? So the first reason is rare mutations with major effects. The second one is these common genetic mutations. Lots of common genetic mutations, but when they come together and interact with each other, they have a major effect. So people still don't know which one is which, and that's why recently the system biology area is very where people are trying to relate, because previously people are only studying a single gene or protein, and for system biology they're trying to relate all of these genes, protein together to form a network to try to explain the function and mechanisms of this process. And also these environmental factors can also contribute to this autism. So the second one is this neuron tube effect, which I want to talk about. Okay. So first, some basics of neural tube. So it's actually a term in developmental biology or embryology. So basically, it's a tube during the development of the embryo. So when the embryo after embryo forms, the three layers, which is ectoderm, mesoderm, and endoderm, the next step would be to form this tube called neural tube. You can see the folding of this blue tissue to form the neural groove, and then form this neural crest and fold. Finally, the neural tube is formed, which is actually this blue hole here. This is a cross section. So if you combine lots of these cross sections, it's actually a long tube. This tube is very important because it's the foundation of our central nervous system, or CNS. Because this neuron tube will develop into brains in the upper part, like the spine in the middle part, and the lower part. So basically, the upper part will develop into the head. So that's why, if you look at this right picture here, any defect in the development of the neuron tube, and usually defect is related to the failure of closing of these neuron tube. Because as you can see in this left picture here, when it forms, all of the parts starts to close to form a kind of a isolated or sealed structure. But if any parts of the tube fail to close, it will cause various genetic birth defects. For example, the most famous example is probably this spina bifida, which I will introduce later. So spina bifida, its occurrence is 1 in every 1,000 babies. It's also quite common. It's a neuron tube defect. It affects the spine, and it can happen anywhere along the spine if this tube does not close completely, and it will cause very severe. Like the severe form will cause physical and intellectual disabilities, range from mild to severe, depending on how it is closed, the neuron tube. So basically, there are 3 types of spina bifida here, which varies from mild to severe. Okay, I guess we can use a break here, and we'll continue in 10 minutes.